My name is Alper. I'm a student nurse at the UC Manitoba. Today we're going to be demonstrating a complex wound dressing. So we have our supplies here. We also read the physician's order, and we have a wound care due for today. So we're just going to be doing that. So we do a quick safety check before we enter the patient's room. Wash our hands, and we see that there's no tripping hazard called by nearby. That is closed position based on his dress. Enter into yourselves. Hi, my name is Alper. I'm a student nurse at the UC Manitoba. Can I just check your armband to see if the right patient? So we're washing our hands before we touch the patient. Checking the armband, see number 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay. Can I get you to state your name and your date of birth? All right. And do you have any allergies? No, the patient said they don't have allergies. Okay. So today, Mr. Smith, what we're doing is we're just going to be doing a complex wound dressing change on your abdominal wound. So before I start, are you experiencing any pain? And do you need any pain medication before I start the procedure? The patient said they don't need any pain medication. We can go forward with the procedure, so that's good. Okay, before I start, I'm just going to make sure the bed is at the proper height at our waist level, so we're maintaining sterility, and make sure that the table we're working on is also at the waist height. And we're going to make sure to close the blinds to maintain patient privacy. So we're going to do that. Now we've done that, so we're just going to wash our hands, and we're going to get our sterile tray ready. Okay, so we're doing it right now. Okay. Has to drape over. We don't need this, so we're just gonna put the garbage there. We asked our patient if it's alright if we just place the garbage right by that patient's bedside. So they said sure. So what we're gonna do first is just gonna add our supplies. Okay. So we're just going to now grab our cap on as well and add that in. Then we're going to grab our syringe as well and add that in. Our 30 cc syringe. The wound. And we're just going to grab our extra forceps just in case we need it. And we're just going to add in a few contact applicators as well, just to measure glue and for packing. Okay, and now we're just going to add in our products. Opening it up like this. Okay, and putting it in. Okay, and this is still within the sterile field, so we're just going to actually just move it a bit closer. Okay, we're going to add our sterile water here.
Hey guys, how's it going?
So we're just going to now wash our hands. We're just going to wash our hands and put our clean gloves on. So do that right now. Okay, and we're just going to go assess the wound here. So we're just going to get our ruler as well, just Q-tips as well, just to measure the wound. So Mr. Smith, we're just going to assess your wound now, okay? Okay. And we're just assessing the wound, so there's moderate amounts there saying there's drainage on the abdominal pad and the 2 4x4. And we see there's also moderate amounts of drainage on the 4x4 of serous fluid. And we're just going to grab our forceps as well to, okay, dispose of that in the garbage because it's contaminated, and we're just seeing that there is also moderate amounts of serous drainage on this as well. We're assessing the peri wound, and we see that there's redness. There's no signs of redness, no edema or swelling, and that looks intact. And also the wound bed looks like there's signs of granulation, no eschar or slough present, and there's no foul smelling odor. We're just going to measure the wound as well. So it's about 13 centimeters in length and about 3 centimeters in width. Okay, so we're just going to dispose our gloves, wash our hands, and we're just going to assess the tunneling and undermining and the depth after. So now we're just going to do is we're going to don our sterile gloves. So we ask our patient, is it alright if I don my sterile gloves here? The patient says sure. We're just going to wash our hands before we put on the sterile gloves. Okay. So we're going to don our dominant hand first. Okay, so we don our sterile gloves. Now we're just going to irrigate the wound. So we're just going to grab 15 cc's of normal saline. But for the purpose of this demo, we're just going to grab, for the purpose of the demo, we're going to grab 15. But in a clinical setting, we would grab 30. And we're also going to grab our cathon, which we are going to also activate the safety and dispose of that, the sharps, dispose of the needle and the sharps. So we're just going to irrigate the wound now from 6 centimeters above, from clean acidities, and until it runs clear. Okay, we're doing that right now. And from center out. Okay, so it looks like it's running clear now. We're just going to dispose of that in the garbage, and we're just going to dry the wound. Okay. Drying the wound now. We're just going to do it one more time. Okay. So next we're just going to we're just going to now clean the peri wound. Can I get a time?
8 minutes.
So now we're going to dry the peri wound. Okay. So we have dried the wound. Now what we're going to do is we're just going to assess the wound. So we're just going to assess the depth here, which is about 3 centimeters in depth. We're assessing for any tunneling. There's no signs of tunneling. And we're just going to assess for undermining. Okay, there's no signs of undermining. And we're just going to document those assessments that we've done on the wound later in your wound flow sheet. So now we're just going to, what we're going to do now is just pack the wound now. So we're going to dip our acrylics here.
You have 5 minutes left.
Okay. Okay, so we're just gonna now pack the wound. So we're gonna grab our scissors now. Just cut the wound here. I got the dressing. The packing I meant. Okay, so that it touched the peri-wound area there, but I cleaned that area, so it's still sterile. So I'm just gonna adjust it. Okay, so I'm just gonna add the 4x4s here. Okay. The
3
procedure is no longer,
minutes.
right?
3 minutes.
Okay, the procedure is no longer sterile. We're just gonna wash our hands, and we're just going to now put on the Effects. And we'll just put this as well. Wash our hands. Just touching the edges here. Okay. Okay, so we attach the dressing now, so we're just going to tell the patient to put the collarbone nearby, bed at lowest position, patient's comfortable position. So we're going to make sure to wash our hands, get all our supplies, and then get everything ready. And then we're going to make sure to lower the bed and do our exit safety check before we leave. We're going to make sure to go document on our IPN and also on our wound flow sheet that we've done everything. So now we're just going to wash our hands and exit the room.